So hello everyone, this is Joseph Fair again, and I'll be answering your questions today. Again, just to get started, I am a virologist and epidemiologist, so if you have any kind of medical questions, I recommend you consult your physician on those. So I'm just going to be able to answer as a scientist, so I can answer your questions about the pandemic itself, where we are, and any other questions you might have if you want to start those rolling through. You're going to see that I have two cameras on because it's impossible to read all the questions that come in on my laptop itself. So I'm going to be reading from my phone, and you're going to see my ceiling just because I'm reading from the phone. And then you'll be seeing me look at the camera to answer your questions. So this is, sorry, yeah, you're seeing my forehead. I have to read it from the phone, sorry. I'm not sure if you can see the online version of this or not. Okay, you can't, of course. Well, I'll just do it from my phone then, sorry. I'm trying to answer it by the computer and the phone, but that didn't work. So I'll try to read through these as fast as I can. Yes, I do have pants on, to let you know. And no, I'm not a hostage. Do masks really help? Let's talk about masks first. So the guideline on masks are changing, and they're changing because we based everything we know on the SARS-CoV-1, SARS coronavirus 1, which happened in 2003. And the way that we usually respond to viruses, especially when they're new, is that we base it on what is its closest relative. So the reason that we did not use masks in the beginning, and the reason the guidelines may be changing, are that SARS-CoV-1 and SARS-CoV-2 are genetically closely related, but SARS-CoV-1, we found that you could only transmit that when you were symptomatic. With SARS-CoV-2, we're finding out that a lot of people actually are getting this because they are asymptomatic and transmitting that way. So right now, the guidelines on masks are currently under revision and may be changed. And so that's why we're using mask, or considering using mask, and I suspect we'll go with that. So here's my advice on the mask. I would say that, the way that this is going to work is that if you can put something around your face, be it a bandana or be it a scarf or something like that, you're going to want to use that just to cover your mouth, and that should help you protect others. It's not necessarily going to protect you, so you're going to have to keep this on your face, but don't get rid of your social distancing guidelines. I understand my phone is on the being used. Sorry, so how long is this going to last? So I expect this is going to go on for many months to come. We're going to at least have active cases up until June, etc. And that over the summer we can presumably see a dip as we do with the cold and flu season, but we will see a second wave in the fall. And so the second wave in the fall is going to be expected. So I don't expect the social distancing measures to go away even over the summer, just because you can get colds and flus in the summer. And it is a time when we also, we want to keep those social distancing guidelines in place to get rid of as much of the virus as we can. Should we be scared? That's a question right now. Everybody needs to be precautious right now, take precautions right now. Where can we buy masks? Masks are generally sold out right now. That's why I'm saying, in general, you're going to have to do something homemade. And again, it doesn't mean you can't, or it doesn't mean rather that you should get rid of the social distancing measures. Masks can give you a false sense of security because you can still get infected through your eyes. It's more to protect other people if you're asymptomatic and don't know it. How do you get COVID if you're not coughed or sneezed on? That's from Kathy. So Kathy, the way that you get COVID if you're not coughed or sneezed on is if you've touched a surface with your bare hands or even with gloves on, and then go ahead and touch your face in one of the three routes. You still have to come into direct contact with the droplets themselves. the symptoms are widely available online. It's a dry cough usually that starts out. Any loss of taste or smell, we're learning, is strictly associated, not strictly, but primarily associated with COVID-19. So a loss of taste or smell is a good way to know that you do have it. So if you have that loss in taste and smell, that's the only symptom I'll really go into. You can presume that you might be COVID positive in that way. You read in studies in China that the virus can suspend in air for a long period of time and even spread that way. Right now, all we know is that it's not an airborne virus, and so you still have to come into direct contact. Airborne means it's lighter than air and that it can stay in air for a long time. The studies that you did read were from nebulizers, and that means that in a laboratory they could make it suspend in air, but that was a purely artificial way of just seeing if it could be done that way. That doesn't mean if it's not, that's what happens. Is the epidemic similar to the Spanish flu of 1918? It's much less deadly than what we saw in 1918. 1918 took about 16 months around to go around the world, and keep in mind that was before airplanes. That was just by ships. It was actually called the Spanish flu, but it originated in Kansas. We first noticed it in Spain when our troops arrived in Spain. So we saw around 23 million deaths, up to 50 million deaths. Nobody knows quite sure during that time. So not as bad as the Spanish flu of 1918. Who can we contact about unsafe social distancing and over occupancy of essential workspace from the governor and the mayor? So that's really going to be your employer. I wish I had a better answer for you for that. But if things aren't being done the way that you feel comfortable, or you're not seeing the measures implemented that you should have with the social distancing, it's safe to stay away. I know that may cost you your job and things like that, so you have to take those things into consideration, but you've just got to pay attention to what's good for you in this time. And if people aren't following it, like for example, if you go into a grocery store where people are not following the social distancing guidelines, then you're going to have to be really careful. Should you get a pneumonia vaccine, and will it help? Get the pneumonia vaccine if your physician recommends it. It's not necessarily going to help you with the COVID-19 pneumonia that would develop there. That's for bacterial pneumonia, so that's what it is. Is it true that can be spread through just talking and breathing now? Really, it's only through expelling droplets from your mouth, and so that's going to come out through direct contact, through either coughing or sneezing. But if you're a spit talker, then yes, it can come out through that way, but you're going to have to be really close to someone. So if you're maintaining that 6 feet of distance, you're not. Does the virus die in heat? The virus does not die in heat unless it's extremely high temperatures, so talking about 120 to 130 degrees. When you keep in mind the body temperature is 98.6, it has to be a lot hotter than that. So what actually kills the light in the heat in the summer is actually UV light. Why is military equipment moving in? The military actually is probably the best prepared organization to respond to epidemics. They have pandemic simulation scenarios at least once or twice per year. There's the National Strategic Stockpile, which I'm sure you've heard of. That is military operated usually, and because of their extreme ability in logistics. They are very, very good at setting up hospitals very quickly. And that's why we're using the National Guard and the military. It's not to police anyone, it's to offer medical care. You're seeing the Comfort and the Mercy, those are Navy ships. So people that don't have COVID-19 that are low risk will be moved onto those ships, and hospitals will be turned into places where we just really see the COVID-19 patients. Mutations of the virus. Coronaviruses actually have a very low rate of mutations. There have been some mutations in this virus, but very minor, and we don't believe that there's anything that has made our strains that we're seeing in the United States. They're not different strains. They're the same strains that we saw out of China with some very minor genetic distinct mutations from them, but nothing that would indicate that they have been, that it's a different virus. It's still the same virus that we saw in China. The Z-Pak and the hydrochloroquine, the studies are still out on that until we have an actual clinical trial, which is going to take anywhere from a month to 3 months, where we actually look at patients that got that versus patients that didn't, and they have a statistically significant number of patients that have had it. You're not going to know the difference. So is breathing range dangerous now? So, 3 to 6 feet is the range that you want to stay away from someone, and that's what we call social distancing. So I really recommend staying on the 6 feet end of that, minimum 3 feet of anyone that's not in your household. Can the virus attach to animal fur and transfer to a vet handling the animal? There's been one dog that was infected that was out of Hong Kong. That being said, it's the only animal that we know of. The nature of hair, the virus wouldn't last that long on it, and so it's a low chance that you would get it that way. I can say I have 2 dogs myself. Dogs are not going to react well if you're not petting them, etc. The only thing I can say is definitely don't let your dog lick you in the face on a normal day. You just got word that UPMC has developed a vaccine, and they're just allowing it to be used. Vaccines, unfortunately, are not that simple. The UPMC vaccine has worked in the laboratory. Now it'll go through a series of animal tests, and those animal tests will then tell us how it's going to react in humans. I'm actually not sweating, it's the light on. I can turn it off if that helps you. Oh, sorry. How's that? I hope that's better. Does the virus die with rain? No, it does not. When will the problem end? We are very scared. That's understandable. But unfortunately, this is going to be the new normal for quite some time. The peak of the virus, at least in this season, is probably going to be anywhere from 6 to 10 weeks from now, maybe less than that. Right now, without diagnostic testing everywhere and knowing that we have a lot of people out there that are asymptomatically transmitting the virus, we don't really know when the end is going to be to this. I mentioned this earlier, but we can probably expect to see a dip in the summer, but that's going to be it. I'm in Iowa and I'm a salon owner. Should we be closed to May 1? Unfortunately, yes. This should be nationwide, that any non-essential businesses should be closed, and essential businesses are considered groceries, pharmacies, hospitals, etc. I answered who I was in the beginning, but I'll tell you again, Joseph Fair. I'm a virologist and epidemiologist that specializes in emerging infections and viruses, and an embassy scientist. I have an immune-compromised son on Gamma Guard. I'm scared. What should I do? So anyone that's immune-compromised, you're going to be taking extra precautions around that person. So whoever is going outside of the house to do the essentials like the grocery store and the pharmacy, you are going to want to keep some social distancing between you. If you can put on a mask, even if it's a homemade one while you're home, I recommend doing so if you do have someone that's immune-compromised in the house. How can you tell if they've had COVID-19 and not just allergies? So you can't, and that's the problem. That's why we have to assume everyone is infectious until you have a test and know that you're negative for COVID-19. That being said, even if you're negative for COVID-19, it doesn't mean you can't get it. So until further notice, everyone should be assuming they have COVID-19. I'm just going to say hi to Shannon from Hazel, Kentucky. I'm from Kentucky myself. Would it be good for us all to wear masks if we have to go out? The guidelines are changing on that, and I talked about that a little earlier. I'm not sure you heard, but right now the guidelines are leaning towards yes, you should wear a mask, even if it's not a medical mask. But don't let that give you a false sense of security. You still have to do the social distancing measures that we've discussed at length. So staying 3 to 6 feet away from people, washing your hands religiously, making sure that any surfaces you touch, you have something between you and that surface, be it a tissue or a glove, and do not touch your face. That's a hard habit to learn, but you'll learn it after a while, and it'll become standard practice for you. We talked a little bit about mutation already, but what are the chances of COVID-19 becoming a new strain of the virus or becoming a true airborne virus? It's very low from what we know from historical coronaviruses. So the mutation rate for coronaviruses is very low. So I don't, in my experience as a scientist, expect this to become a true airborne virus. Yes, until summer. Unfortunately, until summer. We still get colds and flus in the summer, just not nearly as many. Darren asked, would it be safe to have a surgery or is it too soon? It depends on the surgery. If it's a life-essential surgery, then there's not much choice. If it's an elective surgery, then hold off on having that surgery. When I mean second wave, what do I mean? Ala Guru asked. So second wave means that typically we see a dip in cold and flus in the summer, and then we see a resurgence of cold and flu back in the fall when we get back into cold weather. So we expect that second wave to occur back in the fall when we do get back into our cold and flu season. Will this go into 2021 based on the second wave you mentioned? My anticipation is probably yes, that it will go into 2021. Do you always have a fever? No. The symptoms vary in this, and that's why a lot of people are being able to transmit this asymptomatically. Lockdown all year. It's too early to say. The only way I can answer that is if everyone is doing the social distancing and we're able to flatten the curve that we've all talked about, then the lockdowns will end much earlier. But right now, not everybody is doing that. Not all states are doing that. So in the states where lockdowns have occurred, you're seeing a lot less death, and you're seeing a lot less transmission. In the states where that hasn't happened, they just haven't had it yet. And so states like Florida, where there's not a full lockdown, you can expect to see a lot more cases in places like that. With a CD4 of 333, should I take extra precautions? I don't remember my exact CD4 cutoff levels, but that does sound a little low. So, you want your immune system to be strong, and we should all be taking the same precautions. You're right about carefully handling money. Money is one of the filthiest things that we actually touch during the day, so money is always going to be a dirty object. It doesn't last that long on money just because it's cotton and porous, but that being said, you should be extra careful with handling cash. Bill talked about making your own mask. It's very easy, and right now I'm going to say that is going to be the guidance. It's not the official federal government guidance yet, but studies are leaning towards keeping a mask on keeps asymptomatic people from transmitting the virus, and we think that's the primary way of it spreading across the country so fast right now are the asymptomatic people transmitting the virus. So it doesn't make you safer, but it does keep you from transmitting it just in case you have it and don't know about it. Jim says, I have a heart disease called hypertrophic cardiomyopathy and have had bacterial endocarditis in the past. I've heard that COVID can cause endocarditis. That's true, and heart disease and cardiomyopathy are a high-risk category. So, Jim, you're going to need to be extra careful and take all the precautions even more seriously than other people. By the way, low risk or high risk, everybody should be taking the same precautions right now. But those of you in the high risk categories, you want to be especially careful. Make sure that when you do go out, because you are going to have to go out at some point, make sure that when you do go out that you're going to take maximum precautions. Even more so if you see other people being unsafe, say in a certain grocery store or something like that, best to just walk out and find a place that is taking it more seriously and where people are being safe. I'm from Delaware and my son is in a prison. Are they safe? So I just talked about that today on air. Prisons are at particular risk right now. They are in a worst case scenario, to be honest, just because they're in very close confined spaces. My recommendation today on air, and I think this is being considered across the states, is that any nonviolent offenders be released and that guards be provided with personal protective equipment, just because anyone coming in and out of the prison is going to be more at risk, and I am recommending that, at least for now, visitations stop. It's 1 million victims, United States having more than 230K. What's going on? Well, the United States, We don't have uniform lockdowns. In the beginning, as you know, this was called a hoax. A lot of people didn't take it seriously. A lot of people still aren't taking it seriously. So we have a lot more cases than anyone else. We have just under 330 million people in this country. So we're going to have a lot of cases, and unfortunately the 230,000, that is in a best case scenario with everyone taking maximum precautions. Is it true the virus can stay in the air for 6 hours? I haven't seen that, and the only time that there was a laboratory study on the virus staying in the air, it was done on purpose just to see how long theoretically it can stay in the air. But we know of no known cases where the air has been sampled and we could detect the virus, at least from a laboratory study yet. When it's not considered elective surgery, unfortunately, I'm in the same boat. So if it's a life essential surgery, then you're going to need to have it, and check with your physician beforehand to see what precautions they're taking in the hospital. Have they had any cases in that hospital? And how they're protecting themselves. That's a very reasonable question to ask your surgeon before you're going into that surgery. How long are people contagious before and after testing? Before is hard to say because we know a lot of people are asymptomatically transmitting this. After testing, you have to be tested 3 times and test 3 times negative for you to be considered negative for the virus. Could children that were sick and with severe flu symptoms in January have been asymptomatic? Indeed, they could have. In fact, we detected the first cases in January in Washington, but undoubtedly the virus was already here probably in December and spreading from that time forward. So do we have to wear all this at home? It really depends on what you're doing at home. If you have people that are going out regularly, I had a question the other day from someone that, their wife was a nurse or their husband was a nurse working and coming home. So if they're working in a healthcare setting and then coming home, it's a good idea that they do wear a mask while they're at home and practice social distancing at home. I know that is really inconvenient and not ideal for a home life situation. That being said, these are extraordinary times and we have to take extraordinary measures. Do you have to wear a mask even if you're in your own yard, even if I'm 18 years out transplant patient? So if you're out in your own yard and you're not around other people and you're maintaining that social distancing, you don't have to wear a mask. It's not passed broadly through the air, and you don't have to worry about it being transmitted through the wind. Especially if you're out in the sunlight, UV light will disinfect it. Is it essential workers that are going to get it later? Essential workers are unfortunately more at risk than other workers, just because, especially if they're coming into contact with the public. So anyone working in a grocery store, anyone working in a pharmacy, definitely anyone working in a hospital or first responders, they're at a lot more risk. And you've seen a lot of first responders that have been infected with the virus. So if you're in contact with others that are not in your immediate household, then you're going to be at higher risk. No, this is not a man-made virus. We have been looking at that extensively because originally there was some conspiracy theories that this had been weaponized. The genetic studies have shown that this is a very close cousin of SARS-CoV-1, and we knew about thousands of coronaviruses before this one, and this fits kind of right in the line with what we found in the natural coronaviruses that we typically find in bats. Is it true that the masks China distributed in the world were infected? I've never seen anything like that. It was true that there were some masks distributed that were ineffective, but they were not infected to my knowledge, and I know that they have been tested. I have diabetes. Should I worry? Diabetes is in the high risk category, so you should take extra precautions. You should take the same precautions that we're recommending for everyone, but especially if you have someone going outside the house or if you yourself have to go out for something, you should take extra precautions because diabetes is a high risk. Is it in the air if I open my window? No, I have my windows open all the time. It's good to get fresh air. It'll actually help you mentally get through this. It's fine to walk outside as long as you're maintaining at least 6 feet of distance from someone else. then you're going to be fine walking outside, and I recommend getting that exercise. In general, I recommend getting exercise, period, even if it's in your house. It does help you lower your stress and cope with this more. Why didn't we social distance during the Spanish flu? It's honest, we didn't know enough about microbes back in 1918 to know about social distancing. So social distancing has really developed over the last 40 or so years as a public health practice. Is it aerosol? No, this is not an aerosolized virus. You still have to come in direct contact with it. The only aerosol that's been made was in the laboratory, and that was just to see if it was possible to be spread that way. So it is not an aerosol virus at this point. Are you immune once you have the virus? The only study that we have, and this is from rhesus macaques, which are a monkey model that we use for most human diseases, have shown that they could not be reinfected after they were infected. Now the question is, how long does that immunity last? And we don't know that answer. So presumably, just like with a regular cold or regular flu, you cannot be infected with the same strain at least immediately after, but it's a big question mark of how long that immunity will last. Why don't we just do a nationwide quarantine? If you've seen any of my broadcasts for NBC, that is exactly what I'm advocating for, and it's a federal government decision. Each individual governor has to make it for their own state, but if the federal government mandated it under the Public Health Emergency Act, then we would have a national-wide quarantine, and frankly, that's what should happen. Does Lysol work to disinfect your home? It does. You're just going to have to use it on the surfaces you use most, as well as any place that you're touching often. You can also use it on food containers and things like that. The key with Lysol is letting it air dry. Don't wipe it off. Once you let it air dry, it will actually do the take care of the disinfection. I've answered a lot of these already, so I apologize while I scroll through. Drinking hot liquids. Drinking hot liquids unfortunately has no effect on the virus, so drinking hot liquids won't help you out. Food is still being sold. Can that be dangerous? It's really the packaging. So it's, if you're ordering like from Uber Eats or something like that, I recommend you stick with hot foods. And then microwave them once you get them. It's the packaging itself that is the most dangerous. As long as you microwave it for 20 to 30 seconds, you should be fine with that. If you're bringing home like a frozen pizza, for example, it's the cardboard that, the virus can last onto that up to 24 hours. So take it off with gloves, rubber gloves if you have them. If not, even yard gloves would work, and discard of the cardboard box immediately. Same with any other kind of packaging that comes with your foods from the grocery store. Do homemade masks offer protection? They offer protection to others because we know a lot of people are at risk of getting the virus. They offer, some protection to you, but don't let it be a false sense of security, and because you can get it through your eyes as well. So unless you're wearing a mask and goggles, you're only protecting 2 out of the 3 routes of transmission. Can you have the coronavirus and no symptoms? Absolutely you can, and we believe that's how the virus has been transmitted so broadly and so quickly around the virus. Does the virus die after a patient recovers? So you no longer have the virus, and theoretically you are immune to the virus after some time, according to some laboratory studies that we've seen, and that answers the next question as well. Sorry, I'm just scrolling through for the questions I haven't answered yet. Do you need to stay away from your grandkids? So this is a really hard one to answer, but the answer is ideally yes. It really depends on the agreement that you have, with your children and their grandchildren. If they're doing the proper social distancing and the kids are not being exposed to others, and you have a minimal risk for them exposing you, it's more you that we're worried about than the grandkids, because kids overwhelmingly are getting better and not dying from this. It's better to at least keep some social distancing from the kids. If you are going to be around them and it's not a choice for you, then I would recommend that both they and yourselves wear a mask, and that you keep them washing their hands very regularly, as well as yourself. When might rapid testing be available? So rapid testing are rolling out right now to tell you if you acutely had the virus, but right now it's still going to take a while to ramp that up all around the country, and that's key to getting this under control. Does the virus live on clothes, hair, etc.? The way that cotton and other materials, they're porous and they tend to dry it out faster, and the quicker it dries out, the less likely it is to survive. I can say that definitively, when you wash your clothes, the detergents in the soap itself, that breaks down the virus's envelope and inactivates it. So it can live on clothes and hair, but very minimally, and chances are that's not the way that you're going to get it. You're going to get it by being in close proximity to others. If you're a healthcare worker, you need to take extra precautions though with your clothes. And what I recommend to healthcare workers especially, or anyone that's working in a job where you have a contact with a lot of other people, have a designated place in your house where you take off your clothes, your street clothes and your shoes, and you put on your home clothes. Think of Mr. Rogers, as soon as you get home, opening the closet, changing right there, and keeping that around. I'm a delivery driver and my job is considered essential. Would you recommend masks, gloves, wipes? Yes, I would. In fact, for your job in particular, just because you're handling a lot of different packages and you're coming into contact, not directly with a lot of people, but you're coming into contact with a lot of objects and surfaces, I would recommend that you do wear all of those three things. On blood type, that's still out for debate, but there's been no scientific evidence that blood group 0 is less likely to get infected. How does it affect those with liver disease? Really, it's not that it's liver disease specific, but it's that your immune system is lower with liver disease, so you're in a high risk category. Therefore, you have to take, really, really strict precautions. Everyone should be, but we know everyone's not doing that. But if you're in a high risk category, absolutely minimize your contact with others, especially people outside of your household. What if you have the other symptoms but no fever? Fever is not a defining trademark of this. Some people get fever, some people don't. If you have the other symptoms, then you might want to consider getting tested. Can kids go outside without a mask on? As long as they're not around other people, say if it's just in your backyard or if in your front yard but not around any other people, they can absolutely go outside with no mask on. You thought you had the flu, but I think it's coronavirus because I still haven't gotten my taste back, and it was February, so do I need to get tested? That is kind of a defining trademark of COVID-19, so I would recommend at least getting an antibody test. If you are still feeling any kind of symptoms, you want to get the acute test. If you describe the symptoms you have of no taste buds and no smell, then you would probably be in the category that would get tested. Chiropractors are not considered an essential business right now, unfortunately. So your daughter is working at the hospital. What extra precautions can we take? I'm not sure if you heard my answer earlier, but have a designated area where she takes off her clothes in the house and changes from her hospital clothes or street clothes into home clothes that you only use at home. I'd recommend immediately taking a shower, once you got home. And just have a special area, so you're going to have to take extra precautions, and she probably should wear a mask while in the home, especially if she's coming into contact with COVID-19 places. Nebulizers are risky. I don't know, the way that the talk about the virus being airborne, that was actually done with a nebulizer. So nebulizers, if you don't absolutely have to use it, then don't use it. Will we survive this? As a species, yes, we will survive this. This is not The Walking Dead. This is not going to kill everyone, but make no mistake, a lot of people are going to die from this virus because, frankly, our government was very slow into responding to it and still continues to be very slow in responding to it. What about the 5G theories? I actually just heard the 5G theory the other day. There's absolutely no relevance to the 5G theory. This virus is spreading throughout sub-Saharan Africa right now, and there is no 5G in sub-Saharan Africa, so there's no credence to the 5G theory. I'm an RA patient and receive infusions of Simponi. You know, I'm not a physician, so let me answer it this way. Talk to your doctor about that. If those infusions are absolutely necessary for you to treat your disease, then you definitely shouldn't stop them, and the same goes for chemo or any other treatment like that is necessary. Saliva, definitely, not just mucus, not music. Saliva is a way of transmission, so when you're coughing, it's actually the saliva droplets that transmit the virus onto the mucous membranes of others. How does it affect someone with type 2 diabetes? You're at higher risk with type 2 diabetes, so you would likely be one of the cases that would have to be hospitalized. Will silver kill the virus like the church says? No, it absolutely will not. Silver is effective on surfaces, but do not ingest silver, colloidal silver, or anything like that. That will do a lot more damage to you than it will be good. And yes, we will overcome this, Lynn says. Be calm. That is true. We will overcome it, and we'll overcome it much, much faster if everyone is doing the same thing. Would the tanning bed help kill the virus? Not if you're infected with the virus. You know, if you want to disinfect clothing or something like that and putting it inside of a tanning bed, yes, just because UV light will inactivate the virus. Are seniors the only ones vulnerable to dying from the coronavirus? We're seeing a lot of different things here in the United States with this virus, and we live a lot different lifestyles than most people do around the world, so young people are dying of this virus. It's actually, you know, a lot of the younger people that are not taking this seriously, so they're the ones primarily responsible for transmitting the virus at this point, at least socially. I'm not going to blame it all on them, but that is true, and we're seeing a lot of younger people die. Typically, the people that are dying younger have a lot more contact with the virus, so they're healthcare workers or they work in a school, something like that, so they have a lot more contact with people that have the virus. Sorry, just reading through the questions I haven't answered yet. Is it true that a recovered person is still contagious for 8 to 37 days? That's why you have to be tested negative for three times at least, and if you've tested 3 times negative, then you are no longer contagious. The virus will keep spreading as long as grocery stores, bars, etc. are still open because people aren't listening. That's true. However, grocery stores are absolutely necessary. So, you know, people still have to buy food, and not everyone can afford to stockpile food. So, grocery stores are unfortunately considered an essential business. I've only got about 1 minute left, so I'm going to try. Are we 100% sure this isn't a biological attack? Yes, actually the studies have been done extensively to look at the genetics of this virus to see if it was engineered, and they've overwhelmingly come back that it was not engineered. I've had a cough for 3 weeks but no other symptoms. If it was a dry cough, then it could be COVID-19 or it could just be a regular cold. But having a cough for 3 weeks, there could be definitely COVID-19 involved, so you might want to check and see if you can get tested. Just reading through still. A lot of the questions are the same, so does gargling salt water help if you've been exposed? No, other than offering, you know, some relief to your throat. It doesn't help anything with the virus itself. Can it live in the air for 3 hours? It cannot last in the air. It can't stay airborne for 3 hours that we know of. It can stay active on surfaces up to 9 days, but not in the air. Your daughter has no symptoms, moving in with you tomorrow, need to be quarantined. It all depends on if she was practicing social distancing measures beforehand. That being said, if you don't know, it's always better to be safer than sorry. I'll answer one last question, and I'm sorry I have to go after this, but what about co-parenting? So that's where you have to have a really strict agreement with your co-parent on the social distancing and what you're doing with your children. As long as you're both doing the same thing, you're minimizing the risk and you're in a much better shape. So I apologize that I have to cut off with that, but that's all I can do for today, and I look forward to seeing you again back on Facebook Live. Thank you.